Okay, it looks like we've got everybody in. I'll go ahead and get started. Again, thank you again for joining us this evening for Boone County. I'm Pamela Lopez-Fettis, Executive Director to the Growth Dimensions Economic Development Organization for Belvidere, Boone County. Tonight we'll be talking about positivity rates, mitigation, and business support. Please note, I just wanted to make sure that everyone mutes themselves. We'll have an opportunity for you to speak and a question and answer period after the presentation. We will also be recording this session for you to share it with others or for you to maybe reflect on it later if you didn't think you heard things correctly. We will be, again, like I said, we're going to be sharing a question and answer opportunity for everyone. The questions that we'll be addressing will be related to clarification, how we can support you, and how we can support your business. So I first like to take this opportunity to introduce you to Forward Boone County. Forward Boone County is a group that came together in April earlier this year as a response to COVID. These are organizations that are dedicated to services, providing services in Boone County. They're combating the impacts of COVID, and they're working together because together we're stronger, and we're trying to develop these solutions. I do want to refer you to our website at www.forwardboone.org. You can also access this website by any of the partners that you see listed above. They also have a link. But without further ado, I wanted to introduce our guest today. This is Amanda Meal. Amanda has worked in public health for the past 15 years and currently oversees the operations at the Boone County Health Department as their public health administrator. Amanda is a registered nurse and has a master's degree in public health. Her studies are in the areas of nursing, public health, gender studies, linguistics, as well as unique intercultural cultural internship and experiences abroad. Please welcome Amanda Meal. Amanda, thank you.
Great. Pam, thank you so much for having me, and thanks to Growth Dimensions. It's been a pleasure to be a part of this initiative since the spring, since we began our very challenging and what continues to be our long journey here with COVID. I really want to thank our business community, our business owners, any members of the public, local elected officials, other leaders that may have joined the call this evening. COVID-19 continues to prove to be a rapidly changing, rapidly evolving situation. And when we scheduled this call, we did not know that the events of today would be available to us. We did not know how quickly things would move today as we received final word from the governor's office on the situation here in our region regarding mitigation measures. So we will be shifting gears a little bit with what we're going to talk about this evening, because we want to make sure that we are meeting the needs of our community, that we are answering questions, especially for our business owners and our local leaders and community members, and just making sure that we're continuing to work with you. That's really a key message that we want to put out, and really the tone that I want to set for tonight. So I just want to give a really brief situational update, make sure that everybody's aware with kind of what we're faced with and what we're dealing with. And then I'm going to turn the program over very briefly to Michelle Gibson, who is the Environmental Center Supervisor at the Boone County Health Department. And she's going to talk a little bit about the press release that came out from the governor's office this afternoon at about 3 p.m., where we did receive official word that our region is going to go into regional mitigation effective on Saturday. And we have some preliminary information as to what exactly that will mean for our region. So let me just back up a few steps and make sure that I'm clarifying for everybody that one of the huge roles that local public health plays in a community is to take a look at data, to track metrics. And we've been doing this for years, well before COVID. But now, especially with our COVID-19 pandemic, we are watching numbers at the local level. We are watching numbers across our 9-county Rockford region. And we are watching numbers at the state level and at the national level as well. So the numbers that we're tracking regularly here locally are our county level metrics. And this helps to inform local and individual choices and activities. And then we're also tracking things very closely at the regional level, which is assisting with the decision-making for possible mitigation actions. So what we're looking at our county level is we're watching 8 specific things. So we call those indicators. We're watching new cases. We're watching test positivity at the county level. We're watching COVID-like illness admissions to our emergency departments. So we work closely with our regional hospitals where our Boone County residents go to receive care. And we are watching the admissions with people who have COVID-like illness. We're watching for COVID-like illness admissions to the hospital, people who need supportive care on a med-surg unit. We're watching ICU bed availability. We're tracking deaths in our county and death rates. And we're watching for clusters, so hotspots, areas where we might have people congregating, where we might have a potential or confirmed outbreak. And we're also watching numbers of tests that are being performed on our Boone County residents. We receive that information on the state level website every Friday, and we're able to push that information out to the community. We're using terms like blue, meaning that we're tracking well with our metrics. We're using terms like orange to signal warning, a warning status where maybe 2 or more of our 8 metrics that we're tracking are not in range, are concerning, are of warning status, which puts the whole county on warning. And that's really how we're looking at things at the county level. So I will make sure that this audience is aware that this week Boone County is in orange status because 3 of our 8 metrics are out of whack. Our number of tests, our test positivity rate, and our new cases per 100,000. So that's what we are faced with right now at the county level. Now let's talk very briefly about what's happening at the regional level. So at the regional level, we get data that we receive on a daily basis. There is a 3-day lag time from the time that that gets reported and analyzed to the time that it gets pushed out from the state to our region and to us. And let me explain what those 4 metrics or those 4 areas of data that we're tracking are. We're looking at test positivity, and we're looking at a 7-day rolling average across the region, so the entire 9-county region population. We're watching for test positivity increase 7 of the last 10 days. We're watching for COVID-like admissions, and we're looking at a 7-day rolling average, and we go backwards 7 of the last 10 days. And we're looking for med-surg or hospital bed availability, and that's a 3-day rolling average, and we're looking to make sure that we never dip below 20% capacity, meaning that all the hospital would have room for would be 20% or less of their bed availability. So we're watching that, and the language that we're using for that is resurgence, meaning that we're seeing an uptick or a spike or an increase in cases or in areas where we have admissions to the hospital or test positivity rates. We're using terms like mitigation, meaning additional public health and safety measures or restrictions that are placed on a specific area of the state. And we're using terminology called tiers, where there might be different levels of mitigation strategies that are placed upon a region based on what's being seen, what the issues are, and how these metrics are tracking. So I want to make sure that this group is aware that not only is Boone County in orange warning status for our county level metrics, but today we received official word that we have been at 8% positivity or above for 3 consecutive days. So Monday, today, Tuesday, and then we were given the information that tomorrow's data, remember that I said that it was a 3-day lag. So tomorrow's data is actually would have been from Sunday and Monday coming in, will also be above 8%. So that test positivity rate at 8% or above for 3 consecutive days in our region triggers the Restore Illinois plan to issue the region that we're in an additional set of mitigation measures. And so I hope that that provides just a little bit of background as to how we're tracking, where we are right now, and what we're faced with beginning on Saturday. So the way that it works is after 3 consecutive days of 8% positivity, then 48 hours after that 3rd day, the entire region goes into those regional mitigation measures. So I am going to turn the call over now to Michelle Gibson, who, like I said, is our environmental center supervisor. She's going to review the information that was released in the press release this afternoon regarding exactly what additional mitigation measures go into effect on Saturday. And then we will definitely be happy to at least take down any questions. If we can answer them today, we will. If we cannot answer them today, then we will work to get an answer to you, and we will get that information out. And then I believe, Pam, correct me if I'm wrong, that we really want to spend the rest of the time figuring out how we can move forward as a community, and also what we need to do to better support our local businesses, as we know that some of these mitigation measures are going to have an impact on our local business community.
That is correct. Thank you.
Great. So I'm going to turn it over to Michelle. Michelle, over to you.
Amanda, do you want to talk to that?
Yep, I think I will. I'm not sure if she's having technical difficulties or not. So the press release that we received this afternoon gives the following information. So mitigation measures taking effect October 3rd, 2020 in Region 1 include the following. So for bars, no indoor service. All outside bar services close at 11 p.m. All bar patrons should be seated at tables outside. No ordering, seating, or congregating at bars. Bar stools should be removed. Tables should be 6 feet apart. No standing or congregating indoors or outdoors while waiting for a table or exiting. No dancing or standing indoors. Reservations required for each party, and no seating of multiple parties at one table. For restaurants, the following will be put into place. No indoor dining or bar service. All outdoor dining closes at 11 p.m. Outside dining tables should be 6 feet apart. No standing or congregating indoors or outdoors while waiting for a table or exiting. Reservations required for each party, and no seating of multiple parties at one table. For meetings, social events, and gatherings, the limit is lesser of 25 guests or 25% of overall room capacity. So for those of you that are familiar with phase 4 of Restore Illinois, we've been able to have events of up to 50 guests. So this will limit us to up to 25 guests only, or again, like I said, 25% of overall room capacity. So if a room is smaller than what 25 people could fit safely, then the capacity would need to be that smaller number of individuals. Even less than 25 people need to be spaced out, and masking guidelines need to be adhered to. No party buses, and then gaming and casinos are to close at 11 p.m. are limited to 25% capacity, and follow mitigations for bars and restaurants if applicable. So if there are gaming locations and or casinos that are connected to a bar or a restaurant, then they would be subject to the information that I just listed above when I explained what is going into effect for bars and restaurants. So it is our understanding that the state health department is going to track the positivity rate in Region 1, as they have been doing over the last couple of months, to determine if mitigations can be relaxed, if additional mitigations are required, or if current mitigations should remain in place. So I also think it's important to clarify how will we get ourselves out of regional mitigation. So I mentioned that our positivity rate, now that as of tomorrow, we will be 3 days in a row of 8% or above. We will need to get our positivity rate as a region down to 6.5% or less for 3 consecutive days. This will allow our region to return to phase 4 mitigations under the Restore Illinois plan. If the positivity rate averages between 6.5 and 8%, then these new mitigations that take effect on Saturday will remain in place and unchanged. If the positivity rate averages greater than or equal to 8% after 14 days, so if we spend 2 full weeks with a positivity rate of higher than 8%, then additional and more stringent mitigations can be applied to further reduce the spread of the virus. So there's one other region in the state that is currently in mitigation, which is Region 4, and those are the counties down by the Metro St. Louis area, just right across the Mississippi River from Missouri. And it's also important for me to mention that in this press release, it clearly indicates that these mitigation measures do not currently apply to schools or school districts. I know we've been getting that question a lot. We've also had questions about our long-term care facilities. We'll be working with them. They follow a different set of guidance through CMS, which is their national accrediting body. And they will be needing to take some additional precautionary measures as well, eliminating visits and becoming stricter again in terms of who can come in and out of the facility, how they track their staff, and some additional requirements that will also take effect here in Boone County. So we'll be working with our long-term care facilities in the upcoming days as well.
Thank you, Amanda. These mitigation requirements can be really challenging for a number of our businesses in our region. And I see that Amy Grafton, Executive Director to the Belvidere Area Chamber of Commerce, is on the line. I was wondering, Amy, would you mind sharing some resources that are available to businesses?
I just want to let everyone know that the big grant had a second round become available about a week ago. You can find the link for the application for that on the Forward Boone website. There's been a total of $220 million made available in this second round for businesses, and 70 million of that will strictly be put away for the DIA areas, which are areas of elevated concern. So if you want to look at the map and see if your zip code or area falls in that DIA category, you can go on the DCEO website. And again, there's a link to that website on the Forward Boone County website. This is a grant, it's not a loan, so the money does not get paid back. And I also wanted to let you know that Region 1 applications will apparently take priority over the other regions because we are a region of stress.
Thank you very much, Amy. So that information can be accessed through Forward Boone website on those grants available?
Yes, there's a link on the Forward Boone website that connects to the DCEO website that will give detail of what sort of businesses are eligible for this type of grant. I know that some businesses were not eligible in the first round, and they have added some different business types to the second round. So those businesses include event spaces, music venues, performing arts venues, indoor recreation, amusement parks, movie theaters, museums, charter and shuttle buses. So those are additions that were made in the second round that weren't eligible in the first round.
Well, thank you.
You're welcome.
We have been some businesses that have remained in business throughout this period of time. Maybe they're an essential business and they've provided or they may have some best practice that they'd like to share. Are there any on the line that would like to share on how you've made some adjustments and modifications to your way in which you delivered business or obtained support? I see the Y on the line. Jen Jackie, would you mind sharing some of your best practices? I don't know if she's having problems unmuting.
Pam, I have something I can add to that really quick.
Yes.
While we're looking for Jen. I just wanted to let everyone know that we understand that the information has been changed, it's been updated. It is and can be very confusing for everybody to understand as things move so quickly. And I just wanted to make everyone aware that the chamber is here to answer those questions, to send you the link for the applications for the assistance, anything that you guys need as we move forward through this, because like Pam mentioned, we are in it together and we're here to make sure that your businesses can remain sustainable through this.
Thank you. And I think you've offered, whether or not they're a business that is a member organization or a non-member, they can access your services as well at this time, identify what their primary issues are, and any kind of recommendations that they would need to help support from the Forward Boom partners.
Yes, absolutely.
Great. Are there other businesses on the line or any questions that we may be able to open up to? We welcome you to share maybe some recommendations, some best practices, how you can support one another, or how we as a group can support you, as a community can support you. Feel free to unmute yourself. Or if you're not able to unmute yourself, if you can write in the chat.
One other thing maybe that we can mention to the businesses that are on tonight is that we have had some PPE donations from FCA. And if you're in need of masks or you need to know where to order plexi from, these are some of the things that we can assist you with. Our job is to put you in contact with the people to get you the things that you need.
Absolutely. So they could actually go to the health department or the city of Belvidere in order to obtain those masks?
I believe the city hall has quite a few masks that are available for people to pick up. The chamber, I have a big case of boxes, so if anybody just reaches out, we can get them to you, drop them. We'd be happy to drop them off, whatever you need.
Thank you. Seeing that there's no questions, I just wanted to highlight some of the things that we have on Forward Boom. We do have resources available. We have links to the this Forward Forum as well as others. We have opportunities for businesses to share best practices with businesses. You can be a mentor for other businesses. You can also access the latest information on the health department, where we are as far as our numbers. There's links to the IDPH website regarding where our numbers are, so you can actually track it along with us. And as you can see, the health department is more than willing to be your partner and trying to help resolve, you know, maybe some questions that you might have, and how do I implement some of these practices. I know we have a lot of businesses in our community that have done exceptionally well in trying to respond to the request of the CDC, of the IDPH, and of the Boone County Health Department. Still our numbers are going up. That's just a matter of fact, and we just need to encourage that we continue to follow these best practices. And Amanda, if you can share with us what these best practices would be again.
Sure. So we continue to push out the requirement regarding masking when out in public. I would say, and this is just a very honest and open statement to everybody on the line, that we are seeing overwhelmingly lot of compliance now with the masking. I think the thing that we have heard on other calls over the last couple of days that it sounds like businesses are still struggling with is that you have oftentimes have customers that come in or patrons that come in that are possibly refusing to wear a mask or making it very difficult for you when you approach them and ask them to wear a mask. I believe up on the screen right now is our COVID information line in our COVID email. We would ask, please, that you all let us know if you are having difficulties with customers or patrons, so that the health department might be able to assist with the enforcement of that, to back you up with the fact that you are working really hard to implement that requirement. So that's really an important thing to message. Hand washing is something that we continue to push out to the general public. For those of you that run food establishments or have a daycare facility, you're very, very familiar with hand washing guidelines. You've been doing a good job this entire time, and we would ask you to please encourage your patrons to do the same thing. Warm soapy water for at least 20 seconds, singing your favorite childhood song, happy birthday, ABCs, whatever it might be. Extremely important. We're also encouraging people to leave situations where they find themselves around a bunch of people who are not masking or not social distancing. So we're asking people really to watch their distance and leave situations where they do not feel safe. If you all are finding yourselves in situations where you are possibly struggling with employees that are being difficult about wearing masks, or you think there might be concerns with hand washing or anything related to sanitation, we do want to hear from you, and we would appreciate knowing what your issues are. If you approach us with a concern because things are not going very well, our goal would be to work with you, not to slap you with a fine or to come down hard on you with enforcement, especially if you're coming to us and letting us know what your challenges are and how we can best help you. Michelle, would you like to say anything? I believe she was able to get back on. Would you like to say anything to the businesses that are on the line?
Can you hear me?
Yep.
Okay. I would just like to say thank you to all the businesses that have responded. Thank you for the ones that are on the line that want to get the education up front. We just appreciate that pretty much everyone has been really helpful in working with us. We know that we have had to implement some enforcement due to what the state guidelines are, and we've had pretty good feedback so far. If you have any questions about enforcement, or if you do get a letter or something from us stating that we've had a complaint, just know that we are willing to work with you. The way that we work is that we will have, if we get a complaint, we'll send you educational information in the mail. If we get a second complaint, we'll come out to the facility and just check out the complaint. And if we get a third complaint and it's valid and we haven't been able to work well with you, then we will forward the complaints over to the state's attorney. That's not to be punitive to you, but that is just the rules that we were given by IDPH. So I'd like anyone who has more questions about that to call me. You can call our main number or leave a message on the COVID email, and I'll get that and I'll respond to you as soon as possible. Or feel free to call me before you get a complaint, just for questions, okay?
Thank you, Michelle. I see that Jen Jackie was able to join us again. Jen, can you share some of the best practices that you have utilized in order to get through those difficult times?
Yes, sorry, my internet is apparently unstable right now. At the Y, we have we shut down for a few weeks and then reopened and took a bit of a different stance with childcare. I think what our success to being able to remain open with this is that we had a very good open communication with the health department, making sure that when we wrote our handbooks for members to return or for childcare services, that we ran everything past them just to make sure, just to get their suggestions, their feedback, tweaks, all of those sorts of things. So we've really been able to work well with those sorts of things. And then also, like Amy Grafton from the Chamber had mentioned, seeking out those opportunities for different grants and that sort of thing. And I'm always happy if anybody has questions about any sort of best practices or how we've done certain things. I'm more than happy to talk through anything. You can always contact me at the Y, and I'm happy to help out with anything as well.
I would say too, if I might, this is Amanda from the Health Department, with a lot of the plans that Jen submitted to us from the YMCA, we definitely made some suggestions. We definitely recommended some alternative options. We went through several drafts. So it's the more that we know at the Health Department level, the better, because then we can really provide you with what you need. So if you come forward with the stuff that you're dealing with or the challenges that you have, then our number one goal would be to work with you, not against you. I can only imagine that it feels like public health is really not on the side of the businesses right now. This is really a tricky time, and the mitigation measures we know are putting a heavy burden on the businesses. But I can speak for what we want to accomplish locally. And are we getting it perfect? Absolutely not. But do we want to try as hard as we can? Most definitely. So please, please let us know what you need, how we can help, and what the challenges are and what the concerns are that you have. And we will work on that locally. And we're also happy to escalate that up to the state level too. If we continue to see things locally that we have concerns about, then we have no problem voicing that at the state level. And we will continue to do so to give voice to what we're dealing with here locally.
Amanda, I have a question that was shared. How often should we have staff tested since we are in the food industry? Actually, does that apply to just the food industry of all industries? How often should people be tested?
That's an excellent question. So the testing guidance, in all honesty, has changed multiple times in the last 6 months or so. I think it's created more confusion than necessary. So hopefully this evening I can clarify what we're recommending right now. So we do have testing sites that are available in Rockford that are available to Boone County residents. There is a testing site put on by Crusader Clinic on North Rockton Avenue in the old Schnucks Logley's parking lot there. And then the University of Illinois Chicago, their Rockford campus on Parkview, right where Spring Creek meets Parkview there, before you get to the river, also offers testing. We have a handout on our website that lists the dates and times that they are open and available. It's free, it's drive up, and it's open to members of the public. I know a lot of our businesses and a lot of our food establishments are sending their employees to be tested at those two locations. People can also get tested through their primary care provider. I also know that Physicians Immediate Care in Belvidere and 2 or 3 of their sites in Winnebago County offer testing options, including a rapid test. I believe that you have to call the day before to make sure that they have tests available. We have gotten some feedback that sometimes they run out of tests quickly, or they don't get a shipment of tests and then they don't have testing available for that specific day. As far as how often you should test, I would just share that in our office right now, given the rising increases in rates and numbers, we are currently having our staff be tested every 2 weeks. So we're doing that out of a precautionary measure. And we want to make sure that if we have an employee who is ill or has any symptoms, or possibly an employee who doesn't have any symptoms that is still carrying the virus, that we exclude those individuals as quickly as possible. So I would encourage everybody to consider encouraging your employees to be tested regularly. The other thing that is going to be available here in the coming weeks, and this is on our website and also on the Forward Boone website, is a series of mobile testing sites that are coming to Boone County. So we have one tomorrow. It's up at Fire District 3 in Poplar Grove, and it will start at 9 in the morning and go until 5. And then we have 3 more testing sites that will be available next week on I believe it's the 5th, 6th, and 7th of October. I do not have that handout in front of me, but we do have that information available on our website. So if you have the ability to send your employees regularly to get tested every couple weeks, once a month, definitely if they're symptomatic, and definitely if they are disclosing to you that they believe that they've had an exposure to COVID-19, they should be tested. We would really, really recommend that. The other thing that is a helpful tool to use is to be doing temperature checks on your employees. We do that on our staff at the health department, and excluding anyone who has a fever of 100.4 or above. and then anyone who has any COVID-like symptoms. And that's the other thing that's been really tricky over the last couple months, is the more that we learn about this virus, the more symptoms are being added to the COVID list. So the current list of symptoms is something that we have posted on our website as well. We can make sure that that is on the Forward Boone website, and we can also make sure that that is available to this group. So those would be my key recommendations: symptom checks and temperature checks at least daily, if not a couple times daily. And then maybe figure out a routine in which you can send your employees regularly to a free community testing site to be tested.
Amanda, can employers get the results of those tests?
That's a really, really, really good question. An employer can get the results of those tests if we have permission from the employee to disclose that information, and or if we find ourselves in a situation where we believe we are investigating a possible outbreak at a restaurant, then we are able to disclose testing results to an employer.
Now, you mentioned restaurant. Does that disclude other types of businesses if there's a possible outbreak? Because it could happen in any type of facility, correct?
You're correct. My apologies. I should clarify. It's more than just restaurants. It would be any workplace setting where the health department was investigating a possible outbreak.
Okay, great. Good questions. Any other questions or areas that you need clarification?
Yes, I had a question from someone earlier. It doesn't appear that salons have been outlined in the mitigation process.
That's correct. We have not been made aware of any changes to salons that will be part of the mitigation strategy at this time.
So any industry not specifically mentioned will continue with the phase 4 guidelines that they previously received.
Amanda, we have another question that came in. If we are not allowed to dine in, are we allowed to have customers come in to pick up food, or do we need to do curbside?
That's a great question. Michelle, I'll let you start with that, and then I'll piggyback if necessary.
So think of it like we had previously in phase 3. You will be allowed to have customers come in. They cannot congregate. So we would ask, just kind of a best practice would be let them order, maybe have them wait in their car, wait outside and come back in, but they are allowed to come in to order. So I know various restaurants did that different ways previously, so you can revert back to what you did, or we can talk it out. You can call me and we can kind of work through the logistics of how you would offer service with no dine-in.
Perfect. Are there any other questions for this evening? You can unmute yourself or share it in this chat screen. Well, thank you very much for joining us tonight. I really want to remind everybody that we are in this all together. We're here to support you, and we want to make sure that you utilize the resources that are available on Forward Boone and through the health department in order to help us help you through this process. And it sounds like, you know, that the health department is really your partner. These organizations are here to partner with you and try to help you create a safe environment for yourself and also to continue your business. Again, thank you for joining us this evening. Again, if there's questions that come up between now and tomorrow or later this week, feel free to contact us. Have a good evening.